Good morning. We have just heard from Dr. Sakdeva regarding how artificial intelligence and big data analytics will become more prevalent in the QI of the future. But there are numerous other factors which will shape the QI process and outcomes in the coming years. Let me begin with a few brief historical observations on QI. In 1966, Dr. Don Abedian at the University of Michigan developed a conceptual model. The model provided a framework for evaluating the quality of healthcare. According to his model, all information about the quality of care can be drawn from three categories or dimensions of care: structure, process, and outcomes. This model continues to be the dominant paradigm for assessing the quality of healthcare in the US. In addition, 22 years ago, two important events formed the legacy of quality improvement and helped set the nation's agenda. The first was publication in November of 1999 of To Err is Human. This landmark IOM report that found 44,000 to 98,000 people died annually from preventable medical errors. The report's shocking findings helped launch efforts to end avoidable harms inflicted on the American healthcare consumers. Next, only a month later, in December of '99, the Healthcare Research and Quality Act became law, establishing AHRQ as the lead federal agency for improving the nation's healthcare. But what will QI of the future look like? One thing we know: healthcare has a constant, and that constant is change. But what are some of the ways that we see it is changing? Number one, the way healthcare will be delivered in the future. Number two, how will healthcare be paid for in the future? Number three, how will it be regulated? Four, how has the digital revolution, which is inverting the volume, variety, and velocity of healthcare data, affecting the future of QI? How is the associated explosive proliferation of networked medical devices providing data related to the future of QI? What is the actual impact of our aging population on quality improvement? And finally, how will the accelerated volume of consolidation, mergers, and acquisition of healthcare providers affect QI? Let's look at these changes a bit closer by examining some of the current trends. First, how healthcare is delivered. Quality improvement has been tied to the paradigm shift of the US medical system over recent years, shifting from pay for service to actual pay for performance reimbursement, with the goal of using payment incentives to recognize and reward high levels of quality improvement. Moving forward, reimbursement implications will be an even more important driver in further raising the profile of quality improvement. While the majority of initial pay for performance evaluations have focused on short-term impact of the clinical processes, in the future, these will likely shift to long-term impact on healthcare outcomes. This pay for performance is actually also heavily tied to regulation, since a large proportion of healthcare in the US relies on Medicare and Medicaid reimbursement. In the future, QI will become a more collaborative effort involving organizations and multi-center partnerships. Quality improvement will move beyond singular endeavors and focus on collaboration among not just individual providers, but healthcare organizations as a whole. Despite these increasing financial pressures, long-term sustainability will require collaboration associated with mergers and multi-center partnerships, with a wide distribution of best practices. Sharing successes and failures will be vital to ensure more rapid improvements across all realms and will lead to optimal care for our patients. How will the digital revolution impact quality improvement? We've all seen the digital revolution hit us in the face in this past year as it was associated with the COVID pandemic. Last January, the National Committee for Quality Assurance publicly released its vision for healthcare quality measurement to the Biden-Harris Department of Health and Human Services transition team. Their paper, The Future of Healthcare Quality, focuses on 4 core areas, with 3 of them being specific to the evolution of a digital quality ecosystem. Those 3 areas dealing with the digital quality include enabling a digital quality system, in other words, implementing a utility. 2, moving to a digital patient experience of management, which captures the patient experience uniformly. 3, strengthening value-based programs with increased adoptions of value-based purchasing programs that drive patient-centered coordination. Digital measures are not the same tried and true way that many of us have used to report on healthcare quality in the past. Our older models, for the most part, still rely on aggregating and making sense of somewhat fragmented data, which is not captured or codified in a uniform manner. Systems that have focused on administrative data, claims and encounters data, and custom-built data translation. This is complicated by lengthy auditing processes, data lag, and medical record reviews that create significant burden for organizations. What are some of the other things that will impact QI of the future? As we just heard from Dr. Sakdeva, artificial intelligence will continue to witness increased development and investment in the future. There is increasing pressure forcing the use of advanced technology in healthcare to assist our already unbalanced workforce. Its use can lead to cost reduction by enabling patient monitoring in real time, thus significantly cutting down unnecessary visits to doctors, hospital stays, and readmissions. It can also improve treatment by enabling physicians to make more rapid and evidence-based informed decisions, and can bring about absolute transparency. AI will not only prove instrumental in enhancing accuracy and clinical insights, as well as security, but could also be fundamental in reducing manual redundancy and ensuring fewer errors as transition to a world of quality in care occurs. The computing powers of artificial intelligence will also drastically cut down the time scientists spend analyzing data and testing molecular combinations as they manipulate formulas and develop new ones. And what about big data? Big data and analytics have brought significant advances, as we heard from the previous speaker. With the help of big data and smart analytics, we are at a point in healthcare where we can make near certain predictions about possible complications a patient can face, their possible readmission, and the outcomes of a care plan devised specifically for them. Not only can this translate to better health outcomes for the patients, it could also make a difference in improving reimbursements and in regulatory compliance. But how about one of the more familiar devices? One of the prominent changes we're all familiar with these days is the use of wearable devices. There's been a huge increase in usage of these devices, impacting quality improvement. Until recently, the most frequent users of wearable devices were people who were less healthy than average and more likely to need hospitalization or interventional care. Today, these wearables are one of the most sought after innovations when it comes to digital health. And the market is quickly diversifying as clinical wearables gain importance and as organizations integrate with each other. Data capture by these gadgets are playing an increasingly powerful role in healthcare. Not only are these devices like the Apple Watch seen here more widespread, they're a valuable tool for incentivizing healthy behavior. Devices such as activity trackers encourage patients to stay more active and healthier on their own, decreasing the need for a provider visit, while more advanced devices can actually monitor patient health metrics such as heart rate, diet, blood pressure on the go. Instead of having to attend a clinic for monitoring, patients can do it at home and always be connected. For example, if a patient's blood pressure spikes or the patient has atrial fibrillation, the provider can receive a notification and take action. Other advances in technology have created a new wave of smart technology products to improve patient comfort and improve care. Hospitals using connectivity and automation with these tools can alleviate some of the pressure on healthcare providers and allow patients and families some individual control. This smart technology comes in many forms to increase comfort and efficiency and decrease risk. For example, hospitals around the country, particularly starting in the Middle East, using smart beds. These beds can self-adjust to the correct pressure and support for each patient's preferences and condition, potentially reducing skin breakdown and hospital complications. They can alert healthcare providers if a patient exits a bed. The smart bed today can monitor the patient's condition through sensor chips that work to monitor a patient's breathing, pulse, and temperature, providing that this information is transferred to a device in the area supervising the patient. They can even adjust to the correct position for delivering CPR if an arrest is detected. Other units are using robots that can monitor a patient without a human provider being present in the room. These are just a couple of examples of the many new uses of smart technology being used in hospitals today. Smart devices and applications of this type will continue to spread and rapidly grow throughout the healthcare field. Another interesting area affecting QI of the future is population health management. This studies and facilitates care delivery across the general population or a group of individuals. It is a proactive application of strategies and interventions to define cohorts of individuals in an effort to maintain and or improve the health of individuals within the cohort. As the risk for a population of patients shifts, the healthcare systems need to know more about the patients that they serve. Our recent experience with the COVID pandemic illustrates how population management on a large scale can actually come into play. For example, the vaccination strategies were developed by CDC to provide the most vulnerable with earlier vaccination, as well as populations involved with essential services to the nation. Let's examine some other changes or trends that are underway. Augmented reality is a current trend, which is particularly powerful in the healthcare field. As you're well aware, the distinctions between virtual reality and augmented reality come down to the actual experience and the devices they require. Augmented reality uses a real-world setting, whereas virtual reality is completely virtual. The augmented reality enhances both the virtual and the real world. One of the early initial uses of augmented reality has been in medical education. Using augmented reality, healthcare providers can actually see diagnoses and procedures right in front of them and learn new skills and expand their knowledge at the same time. Augmented reality is being used currently in minimally invasive surgery, laparoscopy, for example. With AR, surgeons can augment scan results into the patient's body, where it can be used to assist them immediately during surgery. While we can all imagine a physician or a nurse being able to have various treatment options appear on the screen as he or she looks at different conditions for a child with complex medical conditions, much of the crucial information that we need can simply appear in front of us in real time as we treat patients. Another area that we hear daily about is personalized medicine. Personalized medicine tailored to the unique needs, genetic makeup, and lifestyle of each patient will continue to become more important in quality healthcare. Moving past a one-size-fits-all approach will lead to fewer ineffective interventions and better outcomes. For example, doctors have long known that they've been prescribing medications that no drug affects every patient the same way. Yet for many decades, the standard way of figuring out which one would work was trial and error. The field of pharmacogenetics targets how genetic variations influence individual responses to medications. Genetic testing for guiding treatment decisions are becoming increasingly available. These tests get more effective drugs to patients earlier in their treatment and with fewer negative side effects, and some can even reduce costs. A physician can select a treatment based on a patient's genetic profile that may not only minimize harmful side effects and guarantee more successful results compared with the trial and error approach to disease treatment. As we move into a healthcare landscape increasingly customized for patients, both in treatment and service, we must also make sure that we're expanding access so that more patients can benefit from its advantages. One other area that is probably key in quality improvement of the future involves leadership. Leadership will take an investment into training leaders and staff, both time-wise and money-wise. It will take a lot of courage for senior leaders to commit to a new management practice, which may be uncomfortable and untraditional, as quality improvement takes a frontline approach as opposed to a management top-down approach. It will take patience to build a culture, as you will hear later this morning from another speaker. Change is occurring in quality improvement and will continue well into the future. These are only some of the trends and changes that are foreseen. I want to thank you for your attention. And you'll note there are a couple of slides here with some bibliography coming up, but thank you again.